Somebody once told me the world is gonna roll me. I ain't the sharpest tool in the shed.
PNF stretching stands for proprioceptive neuromuscular facilitation. This type of stretching promotes contraction and relaxation of the muscles to help facilitate greater flexibility. The first PNF stretch that we're going to do is the hold relax. With this one, you're going to take the patient to their in range of motion passively. Then you're going to have them do an isometric contraction of their hamstrings into my hand for 8 to 10 seconds. Go. 1, 2, 3, 4, 5, 6, 7, 8. Then you're going to have the patient relax and you're going to increase the range of motion. Do the same thing again for 8 to 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8. Relax. And this is something that you can do 2 to 3 times bilaterally. The next type of PNF stretching that we're going to do is contract relax. With this one, you're going to take the patient to their in range of motion passively. They're going to do an isotonic contraction of the antagonist muscle, which would be the quads. Go ahead and contract. 1, 2, 3, 4, 5, 6, 7, 8. Relax. You're going to increase the range of motion and again contract. 1, 2, 3, 4, 5, 6, 7, 8. Relax. And again, that's something that you would do 2 to 3 times bilaterally. The last PNF stretch that we're going to do is the slow reversal hold. So you're going to have the patient do a straight leg raise actively until they're comfortable. And then you're going to have them contract their hamstrings into your hand. 1, 2, 3, 4, 5, 6, 7, 8. And they're going to increase their range of motion actively. And contract again. 1, 2, 3, 4, 5, 6, 7, 8. And that's something that can be done 2 to 3 times as well bilaterally. Proprioception for the lower extremity is fundamental in correct mechanics and performance. This includes agility, balance, and coordination. These exercises activate the patient's awareness of their body and the control of their body. The example that we have here is going to be a single leg balance. We'll have the patient stand on their injured side with their hands on their hips, and we'll time them for 30 seconds. We want them to keep this position and without feeling like they're going to fall over or lose this position with their hands on their hips. Plyometric exercises can be used to increase strength, speed, and power by firing quickly using concentric and eccentric contractions of the muscles. We are going to do upper extremity plyometric rehabilitation for throwing sports and overhead athletes. The first one that we're going to do is a wall push-up with a clap in between. So if you can just get on the wall like this, feet about shoulder width apart on your tippy toes. Then you're going to do a wall push-up, then you're going to clap. Okay, so do that about 3 to 4 times. Good. And you can increase the speed the further they get into the rehab. The next one that we're going to do is I'm going to have you lay on your back. I'm just going to do explosive ball throwing up in the air. Ready? Good. For sport specific of the lower extremity, it is used to slowly bring patients back into their desired sports of play. This decreases their risk of injury or re-injury. The example here, we have for a soccer player with a lower extremity injury, we'll have them cutting and then taking off into a sprint. I'll show the patient first what it is. So we'll have them start here, have them cut it, and then take it off. So, the patient can do that, and you want to make sure they have right body mechanics and their center of gravity.
Functional exercises are used as a step in the rehabilitation process. These activities include proprioceptive and plyometric exercises. An example of this would be step ups. I'm going to have my patient do this. So you're just simply stepping up. And you do this for 3 steps of 10. Go ahead. All right. And then another exercise you can do, it would be a single leg stance with a Y. So this, you're just going to have them single leg stance with the hands on the hips, and then you're going to touch the ends of the ropes. And you would do 3 sets of 7 with this one, so go ahead. Good. Out of all the manual therapy techniques, neuromobilization is the most dangerous and must be used with care and precision. These techniques are used as a last resort to treat traumas to the body. Oftentimes this technique is used to stretch out the fascia that surrounds the nerve fibers. The 3 neuromobilizations I will be performing are 1, 2, and 3, and they target the median, radial, and ulnar nerve. The first test I'll be performing is the upper limb tension test. This is a test for the median nerve. We're going to be going through a series of tests, and at each step I'm going to ask her if she has pain or numbness or tingling, and if she does, that's a positive test, and we're going to immediately cancel out the test. So, first step is going to be shoulder depression, so scoot towards me. I'm going to do that with my hip. Next is going to be shoulder abduction. Do you have pain with that?
Nope.
Okay. Next step is going to be lateral rotation of the shoulder joint and supination of the forearm. Any pain with that?
Nope.
Okay. And then we are going to extend the fingers and thumb. Do you have any pain with that?
Nope.
Okay. And then go ahead and put your ear to your opposite shoulder. Any pain with that?
A little bit.
Okay. And that is the upper limb tension test number 1. I'll be doing is the upper limb tension test number 2. This is for the radial nerve. It's a series of steps we'll be doing, and if she has pain, numbness, or tingling down her arm, then we would immediately stop the test, and that would be a positive test. So the first step is depression of the shoulder, which I'll be doing with my hip. Next step is abduction of the shoulder, slight abduction. Do you have pain?
No.
Okay. Then the next step is going to be extension of the elbow. Do you have any pain with that?
No.
Okay. And then you're going to immediately rotate the arm and pronate the forearm. Do you have pain with that?
Nope.
Okay. And then you're going to ulnar deviate and then flex the fingers, flex the wrist. Do you have pain with that?
No.
Then you flex the fingers and thumb. Do you have pain with that?
No.
All right. And then take your opposite ear to your other shoulder. Do you have pain with that?
Yeah, a little.
Okay. So, and that is the upper limb tension test number 2. Performing is the upper limb tension test number 3. This is for the ulnar nerve. It's a series of steps we're going to be doing. If she has pain throughout these steps, we're going to immediately end the testing and consider that a positive test. So the first thing we're going to do is depress the shoulder. Do you have any pain with that?
No.
No. Next thing is going to be shoulder abduction. Do you have any pain with that?
No.
All right. And then reflection of the elbow. Do you have any pain with that?
No.
Lateral rotation of the shoulder is also included. Do you have any pain with that?
No.
And then we're going to do pronation of the forearm. Do you have any pain with that?
No.
All right. And then we're going to do extension of the wrist and fingers. Do you have any pain with that?
No.
No. All right. And then take your ear to your opposite shoulder. Do you have pain with that?
Yes.
All right. And that would be a positive test for the upper limb tension test.
When it's over, that's the time I fall in love.